Welcome to Hospitalk, the official podcast of Driscoll Children's Hospital, where we share real stories of hope, healing, and the people who make it all possible. Just over a year ago, Driscoll Children's Hospital opened its doors in the Rio Grande Valley, and what a year it's been. In this episode, we sit down with Driscoll RGV's president, Matt Wolthoff, to reflect on those milestones and share some exciting news about what's ahead. Let's get started. Matt, thank you so much for being here. We appreciate it. It's hard to believe it's already been over a year since we opened Driscoll RGV in May of 2024. Take us back to that moment. What was it like?
Yeah, there was a lot of anticipation leading up to that moment. We broke ground in November of 21, and we'd been building the team and planning and obviously constructing the building for that 2.5 year period. And it all led up to that night at midnight in May, where we were ready to go and open our emergency department. And it was kind of funny. We actually had patients lined up prior to our opening at midnight.
Wow.
And we had to tell them, well, we're not open yet, which was kind of unique. But so we happened to have we had a quick care across the street, and they were able to get care across the street. But our first patient was a celebrity because they came in and they had all of our attention. So it was a special moment, and it was really a culmination of 2.5 years of work and team building and just planning. So the team responded extremely well, and it had carried from that day forward, have grown and carried on and just it's been a fantastic year and almost a year and a half now.
That's great. That's wonderful. I remember that day it being all hands on deck. Everybody was here, ready to go, ready to welcome in our first patients. Is there a moment throughout, probably a chaotic day, right? Lots of exciting emotions happening. Was there a moment that stood out to you the most?
We leading up to that night, we had like you said, it was all hands on deck. We had a command center set up. We had everybody here, but a lot of our leadership team from Corpus Christi was here. So there was a big support team here. But it really was, I think, receiving that first patient really made it real. And again, they were a celebrity. I think they had probably more attention than that family probably had more attention than they wanted at that point. But we were all down in the emergency room ready to greet them and very excited to take care of them. So,
well, I was here probably a week or two before when y'all were going through some of the mock training, getting to know the floors. I think you had a scavenger hunt going on to help staff find places. Yeah. Because you don't really think about, Corpus was slowly built. It wasn't opened overnight with all of these specialties. You all here in the Valley opened this hospital with 8 floors. Day one, we're ready to go. And so it's a little bit different. And it's just impressive. It speaks volumes of your team here, of you, that collaboration that came together to be able to make something like that happen.
Yeah, we were very intentional about building this team. We brought in, I feel like we brought in the best and the brightest around South Texas in terms of pediatric healthcare, and really did a good job of that, and very, very intentional about finding people that shared our passion for taking care of children. That was kind of the key thing is, we knew we would have technically skilled people and at all levels of the organization. But I think that, really the secret sauce was really finding those people that were really passionate about taking care of kids. And we nailed it. Our team was ready. And again, it's grown. We have grown dramatically over the first, 18 months. And so we're going to continue. We're just getting started.
That's impressive. What are some of the challenges that you have faced over this last year and a half?
Growth, growing pains, just like you would expect, right? Processes that maybe didn't turn out to be as effective as we initially thought they would be, or just having to tweak things to make the operations run smoothly. Space, I would probably, if you had to nail me down on one thing that has been the biggest challenge, space is it, right? So we knew going in that we felt like this building was probably underbuilt for what we want it to be, for the future. And particularly in the emergency department. So we have an 8-bay emergency department that we've got creative with. We've created 11 beds out of those 8 bays. But just in the last 12 months, we saw 24,000 children in that 8-bay emergency department, which again goes back to the talent of level of our team that we have in place there, both the physicians and the nursing staff, really everybody on that team in the emergency department, to be able to see 24,000 children in a space as confined as they are, it really speaks volumes of that team. When I was with HCA, typically your capacity would be, the threshold would be about 2,000 visits per emergency department bed, and you can do the math, but we did about 3,000 per bed in the last 12 months. So they are running a very, very efficient ER, and it not only are they efficient and moving patients through quickly, but they are also doing it in a very, very high quality way. And our patient experience scores, our throughput times, and all our wait times, and all those things that we measure have all been very, very impressive.
Yeah, absolutely. And I think it speaks to the volume of the need to have this hospital here in the Valley. It's been a long time coming. We've known that these families here need care of this expertise closer to home. What are some of the special stories that you've heard from so many of these patients? Is there one that sticks out to you the most?
We hear them every day, and so there's countless stories of families that have historically traveled to Corpus Christi or beyond, or Houston or San Antonio for care, and are now getting care here at home, close to home in the Valley. One family in particular is very close to us, and it's Tiali, one of our Driscoll. She was she was for the Children's Miracle Network. She was one of our children who were the kind of face of that campaign. But Tiali's a very special little girl, and she's been with us literally from the groundbreaking, right? She's been at every event. She has a very rare syndrome that requires a lot of care, and so I think we see a lot of her. But she is her family's not having the burden of travel like they were before. And again, it's what's special about her for us is that she's been with us from day one, and her family has shown up at every milestone that we've celebrated. The groundbreaking, the placing of the final beam. I mean, they've been through it all with us. So it's fun to develop those relationships with those families.
Absolutely, and there's so many more families just like that, right? That are not having to travel all the way to Corpus anymore. I do want to ask about that because that's a question I get asked a lot is, well, what are the differences between the hospital? What specialties are offered at this hospital? And are there any cases where you may still have to travel to Corpus Christi?
Yeah, it's a great question. And so let me start, I think, by saying what makes us different in the Valley. And then I can also we can talk about the differences between our hospital in the Valley and our hospital in Corpus Christi. But in the Valley, we are the only designated children's hospital, and actually, between Corpus and Driscoll Children's Hospital and Driscoll Children's Hospital, Rio Grande Valley, we're the only 2 designated children's hospitals in South Texas, right? And so that alone makes us very special and unique. But what makes us different here in the Valley, beyond that designation, is the level of specialty care that we provide, and we have several hospitals in the Valley that do take care of children, and they even some that brand themselves as a children's hospital. But the difference between a designated children's hospital and a general acute care hospital that has a children's service line is really a whole different level of dedicated infrastructure to kids. And so everything we do from the board level to the bedside is dedicated to children. And there's a lot of additional services and programs that we offer as a result of that because we're so focused on kids. And so I think that's what differentiates us from the other hospitals here locally. And when I talk about that specialty care, that is the ultimate differentiator. We have the ability as a designated children's hospital to recruit pediatric subspecialists. And we've done that very successfully over the last 2 to 3 years for the Valley. We have right now in the Rio Grande Valley, we have, I think the last number I saw was just over 60 subspecialists or extenders, or mid-levels that work for those subspecialists. And 38 of them, I believe, are net new to the Valley over the last 3 years. So we are actively recruiting. We're adding depth to our roster and bench strength. And that's really, at the end of the day, what differentiates us from a lot of these other hospitals. And what ends up happening is when they need that specialty care, those kids get transferred from those hospitals to our hospital. Now, the difference between our hospital and the one in Corpus Christi in terms of services is right now we have said that cardiovascular surgery and neurosurgery are going to remain programs in Corpus Christi. Those two service lines, first of all, cardiovascular surgery, you want to have a center where that's all they do and do a lot of volume to be very good at it. And that program in Corpus right now is one of the best in the world and certainly one of the best in the nation. Dr. Langley's doing a terrific job and his outcomes speak for themselves, ranked nationally. And so we want to center that service in Corpus Christi and really, that's one of those services that kids are still going to have to travel for. Now, neurosurgery is a little bit of a different story in the sense that, when we started this hospital, when we broke ground, there was only one pediatric neurosurgeon for all of South Texas full time, and that was Dr. Ashley Hanna. Now we're up to 2 in Corpus Christi, but it's a matter of concentrating your resources and being able to really utilize those resources appropriately. And so right now we're the children are still having to travel for neurosurgical care to Corpus Christi. Now that one, I think in the future, as we're able to add resources, I think that one will probably more more likely for us to be able to provide some of those services here in the future. Cardiovascular surgery is probably a little bit longer of a lead time, but otherwise our vision is to have a full spectrum of pediatric subspecialty services here in the Valley and doctors that live and work in the Valley.
Absolutely. It's just amazing to think about, when families prior to this hospital opening would have to travel to Corpus, you're talking moms or dads having to leave their jobs for extended periods of time, Absolutely. Leave their other children behind at home. It was a challenge. And so I know we all feel, but more so the families feel so grateful to have Driscoll here in the Rio Grande Valley to provide that level of care close to home.
Yeah, absolutely. And the reality is what we're finding is that, the volumes are much higher than what we anticipated. And some of that is that these kids were just not getting care at all.
Wow, that's amazing.
So that's what's really, I think, inspiring and really, what motivates us is that not only are we're lifting that burden off those parents and families to have to travel, but we're actually caring for new kids that may have never been able to access these kinds of services before. I think one perfect example of that is genetics. We just recruited a pediatric geneticist to be full-time in the Valley. Mm-hmm. That's a service that we have never had in Deep South Texas. There's obviously we have one in Corpus Christi, but we've never had that service in the Rio Grande Valley. So that's one example. But yeah, there's a lot of children that are benefiting from that.
Yeah. Well, and a sense of community runs so deep here in the Valley. Driscoll's always had a presence, but this hospital has further deepened that presence. What are you hearing as far as the reactions from the families and the community with us being here now?
That is, again, one of the things that I think that inspires us the most is that the level of support from our community has been tremendous. I mean, whether it be from the cities, and here we're kind of unique in this metroplex that you've got We're right on the line between McAllen and Edinburgh. Both cities have been tremendously supportive. But you also have FAR and Mission and this big community that's made up of multiple cities. But the community, when we've asked for support, it's come. And not only in the sense that they're utilizing our services and they're coming to see our doctors and coming to the hospital, but even in the way of financial support. We were, as we all know, we were built on philanthropy, and we couldn't do what we do without that level of community support. And some of the big corporate partners here locally have stepped up in a huge way. And not only that, but just even our just the individuals in the community who have stepped up and contributed to our mission, either through financial support or just engagement with us on activities and events. And it's been tremendous. And you mentioned that the Driscoll, it was not an unfamiliar brand to the Rio Grande Valley. Mm-hmm. We've been flying doctors down to see kids here for decades. As a matter of fact, last October we celebrated the 20th year anniversary of the clinic in Brownsville. So that clinic's been there for 20 years. So Brownsville is familiar with Driscoll, but what we're finding is that I think that the hospital is a whole new level of commitment, and I think that the community has completely embraced that, and they're very, very excited about it.
That's wonderful. So I want to talk about something now that's exciting, that's new. We've shared this a little bit, but it may be new information for our listeners today, that we are launching a new residency program here at Driscoll RGV.
Absolutely.
Tell us about it.
We're very excited about that, and that's hot off the press. We just found out 3 weeks ago that our program is approved and accredited by ACGME, which is the accrediting body of the graduate medical education. So we are now in full speed recruiting mode, and our first residency class will start in July of 26. So we are, again, we're recruiting a program director that we're very excited about, and we're looking for that first class of residents, which we think will be 8 residents in July. And so the way that timing works is that the approval for our program actually came in a little bit after many of the fourth-year medical student graduates had already started to apply for pediatric residency programs. So we're really trying to get the word out right now.
Okay.
For anyone who's interested in pediatric residency, that we are here and we are now approved, and it's going to be a fantastic place to learn to be a pediatrician.
So tell some of our medical students why they should come to Driscoll to be a resident.
Yeah, it's going to be, I'll tell you, this is going to be a great learning environment. And first of all, the Rio Grande Valley is a fantastic place to be in medicine right now. One thing that I'd point to is that, and I hear this from all of our subspecialists, is that the diversity of pathology here is like nowhere else. It has a lot to do with our demographics and the health of our population. There's certainly an element of poverty that leads to some of the medical conditions that we see, but it also has a lot to do with the border and the dynamics on the border, and just the how fluid that has been, and that we're seeing. You see patients from all over the world, literally, and so. It's a great place to learn. I think beyond that, the quality of life here is fantastic. The cost of living is you can't beat it. It's a wonderful environment in terms of culture and family oriented culture. Just gonna be a good place to learn. And in terms of being part of the growth of the medical the medical infrastructure in the Rio Grande Valley. We have a medical school now that is in its, I believe, in its 6th year, and so that it's there are multiple residency programs popping up in all over the valley, and on the adult side, this will be the first pediatric residency program. But it's just going to be a very, very exciting place to be over the next several years in terms of graduate medical education. And I would say that our faculty are world class. I mean, we have, and I mean that quite literally, we have faculty from all over the world that are extremely well respected in their fields, and are going to be great at what they do in terms of teaching residents. So it's going to be a great place to learn, and really the ultimate goal for our pediatric residency program is to retain those pediatricians in our community, and so we offer financial incentives for those graduates to, if they want to stay and practice here in South Texas, in any of our markets in South Texas, which we consider to be everything from Port Lavaca west to Eagle Pass south, then there are financial incentives that we will offer for them to practice in those areas. And so, if prospective residents have a connection to South Texas or have a passion for taking care of our population, we will absolutely incentivize them to stay.
This might sound like it. If there was a resident that was listening to this and they were interested, what do they do? How do they apply to this?
So there's an online system where where all of the pediatric residency programs are listed, and those fourth year medical students are familiar with that. It's the ERAS system, and so we are active in that system, so they can go on and they can find us and they can submit their application that way. I'd also encourage them to reach out to us with any questions or any questions about the region or our program. We'll be glad to talk to anybody about the future of our program. As a matter of fact, we've had several local candidates who are doing rotations and have reached out and just expressed interest in the program. So we're excited about it.
That is exciting. And I probably should have mentioned, for those who maybe are not familiar with our residency program, that we have an existing residency program in Corpus with 16, residents a year, interns a year. They graduate year 3. So here we'll have 8, and then hopefully, are there plans to grow and expand that in the future?
Well, so yes, so it's a 3-year program, like you said, and so we'll have, ultimately we'll have 24. But I think, in the future, there's no question that as we are able to grow capacity to teach, and that includes physical capacity, we'll look at growing that program. And you're right, the program in Corpus has been in place for many years. I think is almost as long as the hospital has been in place, and it is amazing the network of pediatricians even here in the Rio Grande Valley that have graduated from that program. That was one of the things that I did not fully appreciate when I first joined Driscoll and started talking to local pediatricians, how many of them were graduates of our program in Corpus Christi, which is so cool. There's this Driscoll alumni network here that are extremely supportive of what we're doing.
I love that, and it speaks to going back to retention and keeping those doctors here in the region. That's our goal always is hopes that they stay here and
Absolutely.
They treat the community. We love that they fall in love with it. One of the things too that I think about with this residency program that I've heard from some of our residents, the reason they love Driscoll and practicing there is, one, the diversity, because you have amazing, talented folks from all over the world who come to do their residency at Driscoll. Some of them are already physicians in their home country. They've already had amazing experience, and they're trying to get that here in the United States. And so they can learn from so many different people and so many diverse backgrounds. But I love now our partnerships here locally. We'll hopefully get some more medical students from here in the Valley to stay here, build the practice here, practice at Driscoll here. I think that's something exciting to look forward to.
Our vision is that a kid could literally grow up here and go to high school and go to undergraduate school here, go to medical school here, and then come do their pediatric residency at Driscoll and immediately start taking care of children in the Valley at home and never have had to leave the Rio Grande Valley. And it's so, we're certainly, open to anyone who wants to come and serve our kids. But over the years, there's been so much talent that has left the Valley to have to go either for job opportunities or training opportunities elsewhere. And so this is a new opportunity for them to be able to stay right here at home and get that same world-class training and education, and again, never have to leave.
I love that. Plus, you're near the water and you've got a Costco, so
that's true. We've got.
What could you beat?
Absolutely. I think it's. My wife is originally from Harlingen, born and raised. I was not originally from here. I was all over the place as a kid. My dad was in the military, but he retired in San Antonio, and I went to high school in San Antonio. And I always talk about how there are not too many things, very, very few things that I can't get right here at home in the Valley that I miss that I can in San Antonio. And so, the Valley has in the last, I've been here for on and off for 20 years. And it's amazing to see the growth, not only from a population standpoint, but from an economic development standpoint, and just all the quality of life and all the things that this community has created in the last 20 years. It's just, I'm really proud to now call this home. And you're right, we have in my opinion, and I think I'm certainly biased, but I think I'm right on this. I think we have the most beautiful beaches in Texas. So, and that's not too far down the road. That's less than an hour away. So
yeah, that's wonderful.
Yeah.
I want to touch on your background, your personal connection. You talked a little bit about your dad being in the military. Mm-hmm. You come from an interesting background as well, one in healthcare. Tell us a little bit about your journey to Driscoll.
Sure. Yeah. So I actually was in the military as well. I was an Air Force Academy graduate, and when I graduated from the Air Force Academy, I had an undergrad degree in business management, and I did not at that time. I really felt like I was not interested in making the military a career. I owed, as part of my service commitment as a service academy graduate, you do owe 5 years of time to the military. But I really, I'd seen that, my dad being a career Air Force officer, a JAG, an attorney. We moved around every 3 or 4 years, and I knew that I wanted to set to plant stakes somewhere. I wanted to have to raise a family somewhere and have a place to call home, and so I had to find something to do that would that would translate into the private sector. And so I applied for the healthcare administration program within the military, within the Air Force, and got into that, and did that for 5 years in the military. And then had the opportunity when I was finishing my master's program in San Antonio to do some project work for Valley Baptist in Harlingen, and so did that, and they hired me when I got out of the Air Force. They hired me to come work for them. I worked for them for a few years in physician group practice management, and then also in hospital operations. I also happened to at that time hire Sarah Garza, who's also a part of our organization now at Driscoll. And I'll fast forward this story, but she and I met in our master's program and realized that my in-laws and her family had known each other for years, and so fast forward, I've worked for several different health systems over the years in the Valley, including HCA for about 9 years. But most recently, I was the CEO at Harlingen Medical Center over in Harlingen. And was there through COVID, and Sarah called me out of the blue one day and said, "Hey, I'm applying for a position at Driscoll, and I'd like you to be a reference for me." And I said, "Absolutely, not a problem." I think the world of Sarah, and she said, "Oh, by the way, I think they're also looking for a president for the new hospital in Edinburgh." And at the time, I was aware that Driscoll was starting to build a hospital. I hadn't given it that much thought, other than I knew that there was a hospital coming. And when she said that, I thought, that sounds interesting. I didn't give it a whole lot of thought. That Sunday morning, I literally woke up in a panic and thought, man, I got to get my information into this recruiting, this search firm that's doing this search. I literally just had this just sense of urgency to get my information in. And so I did. I sent my information to the search firm that was doing the search for this job. And they basically said, well, we're pretty far down the road, but we'll let the folks in Corpus Christi know that you're interested, and we'll see where it goes. And from there, it went very fast. I mean, they were pretty far down the road. And so, but I was blessed and fortunate enough to be given the opportunity. And so I firmly believe that was a God thing. Since then I have, this opportunity has blessed me and my family in so many different ways. And it has been such just a breath of fresh air in terms of my career, a total revitalization of my career. I'll be honest, prior to joining Driscoll, I was to the point where I thought maybe it's time to try to do something different. And, I come to work every day just fired up and so excited to be a part of this team. And so it was just a huge blessing. But that was my path here. That's how I got here.
Well, I love that story. And I know that everybody here loves you, your leadership. You've done a terrific job. And so I know that you'll continue to do that. As you look at the next year and beyond, what's next for Driscoll Children's in the Valley? Wow,
a lot. We have a lot of growth plans, and the children of our community need us to grow. We are looking at, first of all, I mentioned the emergency department. We got to have a bigger emergency department. That's one priority. We're building a trauma program. That's another major priority for us. The residency program really right now is our number one strategic initiative to really, in terms of growth, and we want to do that right and make sure that we get that kicked off next year in the right way. But beyond that, we are going to continue to recruit subspecialists. There are certain areas where we have it covered, but we are not as deep as we'd like to be, and so we're going to continue to recruit doctors. But we're also going to look at expanding the physical footprint of this building. We have just kicked off a construction project on our lone shell floor. So we left one in the 8-story tower. We left one floor shell back in May when we opened up of 24. We have started the construction project now on that floor to add an additional 15 pediatric ICU beds. And there have been times in the last year and a half where our ICU has been completely full. And so we need those ICU beds. It'll do a lot for us in terms of capacity. We also do a lot of procedures throughout the facility that we can now do in those new beds. So we're excited about that. We're also adding a laboratory on that floor, which will help us with getting our labs done a little quicker in-house. But that's that next step is expanding our ICU. But then we're gonna continue to grow. Like I said, our children need that. So. Yeah. We'll continue to grow to meet to really identify gaps and fill them for the kids in our community.
That's exciting. Well, we're coming to our time, so I want to end this on a positive high note. Personally, for you, what has been the most rewarding part of this last year, and really even your past 4 years of being the leader here in the Valley?
Yeah, that's an easy question to answer. It's leading this team has been, like I said, it's been the best thing I've ever done in my career, and a huge blessing. And seeing the impact that we are having on our community, and gaining, and even more so, gaining the trust of our community that's what inspires me. Is that that I know that I know that our community trusts us with the care of their children. And this is, you mentioned earlier, the Rio Grande Valley is a very, even though it's a large population, it's a very tight-knit community. And we, I think we have quickly become, very much a part of that community, and our community trusts us to care for their children, and we do care for them like they are our own family, and so that that to me, that's what it's all about.
I love that. Well, thank you, Matt. Is there anything else you want to add today?
I think just again, really proud of the team and what we've accomplished thus far, but that we're just scratching the surface. We're just getting started, and we're going to get better every day. We talk about that we're going to continually elevate the bar in terms of quality of care for our kids here in the Valley. And so I think it's going to be fun to watch.
Absolutely. Well, you have a beautiful hospital, state-of-the-art equipment. It is just amazing to walk these halls and see the modernization, but also the child-friendly, family-friendly aspect. I know we'll see Tesla, our facility dog, down the hall occasionally, and I love that. So y'all have all done a great job. You have a wonderful team here and certainly wonderful leadership. So thank you so much for taking the time to talk to me today.
It was great.
We appreciate it.
Absolutely. Me too.
Thank you for listening to Hospitalk, where we bring you the stories and voices behind Driscoll Children's Hospital. We invite you to like, subscribe, and follow us on social media. And to support our mission at Driscoll Children's Hospital, visit our website at driscollchildrens.org, because together we heal.